Assalamu alaikum wa rahmatullah. Kul aam wa antum bi khair, and hope you have a blessed Ramadan. Today our talk is about irritable bowel syndrome. This is unfortunately a very common disease in the United States and in the whole world. It's estimated about 12% of the population has this condition. Briefly, this is a chronic problem that have multiple symptoms that can include abdominal discomfort, variation between constipation, diarrhea, and bloating that can happen throughout the day. Some patient has nausea, vomiting, and these kind of symptoms. It's very important that these patients are diagnosed by a physician to make sure that there's no other reason for this problem. The fasting has been shown to improve these symptoms in most patients, and some speculation about the reason for improvement in symptoms include improvement in the intestinal motility and sometimes improvement in the good population of bacteria in the GI tract. These are important benefits that can help some patients with irritable bowel syndrome. Some intermittent fasting studies have shown that without going into further details, fasting apparently is very potent into decreasing inflammation in the body, and various studies have shown that. It relates to Ramadan and fasting. It's very important that patients with irritable bowel syndrome identify triggering foods. There are foods that will trigger these symptoms. I recommend keeping a diary of the foods that have been eaten the day before or the same day when patient have a bad day, if you sort of speak, and then look at your diary to see if there is a common triggering food that you can avoid. Relatively speaking, avoiding certain vegetables and foods that contain high fermentable sugars can help. However, every patient is different. Some patients have to avoid dairy products, some patients have to avoid gluten, some patients have to avoid vegetables like beans, and some patients have to avoid things that we consider really healthy like honey and things like that. So it's very important that we recognize as patients what the triggering factors. This is during fasting and otherwise. Like I said, fasting shown to improve symptoms in irritable bowel syndrome. However, very important factor to watch for is overeating at time of breaking your fast. Overeating can lead to worsening symptoms. Some patients would have some discomfort in the abdomen, some of them have diarrhea or bloating. So very important to avoid overeating, which is difficult to do when you're fasting for a prolonged period of time. However, be mindful of that. This is very helpful to our patients during fasting in the blessed month of Ramadan. Other factors that you have to watch for as a patient is to make sure that you are well hydrated. Hydration is very important during this month. Things also that can be helpful is exercise if you can. I know this is difficult during the busy schedule in Ramadan. Trying to decrease your stress level in a month of Ramadan or otherwise other days, and as you probably aware, praying and meditating, reading Quran, all this can have significant impact on decreasing the stress level. Spirituality has shown to improve outcome of many diseases. So subhanallah, this is a blessed month that has so many important benefits for our health and our spirituality. Also, probiotics, generally speaking, these are supplements that contain good bacteria that can help the health of the GI tract as well. Can be considered. These medication can be bought over the counter. This is what I have today for you. Inshallah, you will have a well accepted ibadah and a happy Ramadan. كل عام وأنتم بخير.